Hello, and welcome to our panel discussion about supporting advocacy and education in the disability community in New Hampshire. The three people that make up this panel are from the Federal DD Act Network Partnership in our state. We work together to support advocacy and education in our state, but we each approach this topic in slightly different ways. So we're going to talk about that a little today. Let's start with some introductions. Stephanie, would you go first?
Hi everyone, I'm Stephanie Patrick and I'm the Executive Director of Disability Rights Center New Hampshire. I'm so excited to be here talking to all of you today. Disability Rights Center New Hampshire provides legal advocacy to people with disabilities. That means we have a team of lawyers and advocates on our staff who provide individual representation, provide technical assistance, provide brief legal advice, and do systemic advocacy on behalf of people with disabilities across New Hampshire. We serve people with all kinds of disabilities, but today we're going to focus a little bit more on our work with people with intellectual and developmental disabilities because that's key to our partnership with the DD Council and with the IOD. We serve people on a variety of different disability-related legal issues, special education, discrimination, employment, access to home and community-based services through the area agency system, through the community mental health system, and other places where people really need and have the right to things that they're not getting. We're the ones who go there and we make sure that that actually happens. As I said, we do that through a variety of different things. We provide individual advocacy. We also do class action litigation, which is systemic litigation meant to change the world for people with disabilities and really make sure that not only the people that we're representing, their lives are improved, but also people across the whole state. We have a couple of those big cases right now. I'm excited this year. We have a new mission and vision, and it is to protect, advance, and strengthen the legal rights and advocacy interests of people with disabilities. Our new mission is also on our website. You can check that out too. But we're really using this as an opportunity to start a new year of strategic planning and really looking at what we do best, what we could do better to really improve the lives of people with disabilities across the state. So I'm excited to talk to you today. Kelly.
Hi, hello everyone. My name is Kelly Nye-Lengerman and I serve as the Director of the Institute on Disability at the University of New Hampshire. The Institute on Disability, or IOD, as our acronym, is the designated University Center for Excellence in Developmental Disabilities, or UCED. So you'll often see that acronym of IOD, or UCED. So the Institute on Disability includes over 45 different projects related to disability policy, services, research, training, and evaluation. And we do that in a number of different ways. As a UCED, we have 4 core areas that we focus our work around, and that includes research and evaluation, community services, information dissemination, and interdisciplinary training. That said is that the Institute on Disability, as an institute within the College of Health and Human Services, we have the ability to really serve as this bridge between the disability community and the university. And if we think about the many resources that our flagship university has here in the state of New Hampshire, we have access to researchers, to faculty and staff, to infrastructure that allows us to conduct really robust research, technical assistance, and training in a variety of different ways to a variety of different audiences. And the work that we conduct at the IOD is really focused in on zeroing in on increasing participation, inclusion, and belonging of all people with disabilities. And so Isadora, please tell us about the DD Council.
Sure. I'm Isadora Rodriguez-Legendre, and I am the Executive Director at the New Hampshire Council on Developmental Disabilities. And just as the other two organizations, the DD Council was created through a federal law, commonly known as the DD Act, and that law really established DD councils in every state and territory. We're charged with identifying the most pressing needs of the DD community, and then what we do is we develop a 5-year state plan to help address those needs through different goals, objectives, and activities. At the council, we're dedicated to dignity, full rights of citizenship, cultural diversity, equal opportunities, and full inclusion of all New Hampshire citizens with developmental disabilities. We support public policies and initiatives that remove barriers and create opportunities for people with disabilities to live and work and play in their communities. The council membership is made up of at least 23 people. They're all volunteers, 60% of whom must be individuals with lived experience of developmental disability and or parents or guardians of people with developmental disabilities. The other seats are what we call agency seats, and there are different organizations working to support people with developmental disabilities, like the DRC New Hampshire and the IOD at UNH. A lot of the work that we do is accomplished by partnering with other organizations and community groups that have a similar vision of community inclusion for people with disabilities. And so we're excited to be here today to talk a little bit more about how we do that. Now that you'll know a little bit more about each of our agencies, let's talk about how our organizations approach advocacy. Stephanie, how does the DRC, how does the Disability Rights Center support advocacy work in New Hampshire, and what does it mean to get legal assistance or advocacy from the DRC?
Yeah, so those are two great questions. I'm excited to talk about both of them today. So our job is to make sure that the legal rights of people with disabilities are protected. Many of times those are already outlined in the law, but the actual practices mean that they're not actually happening in real life. So individuals face situations where the law says they have the right to this service or this support or to be free from discrimination, but in their actual job, they're facing discrimination or other barriers to employment, to living a full life that they want to live. And so we enforce the laws that exist right now. We make sure that in reality they're actually happening. And we also spend a lot of time making sure that elected officials really understand the impact of the laws that they're proposing. So we look at the law, we say this could be good for people with disabilities, it could be bad for people with disabilities. This is how we see this really playing out in reality, and help them to understand the impact of what they're thinking about, and other people to understand that too, our partners and things like that, to really look at how these laws would impact people with disabilities. We also enforce the rights of people with disabilities through litigation. Like I mentioned earlier, we have 4 major class action litigation cases right now to enforce specific rights of people with disabilities related to older youth who are in the foster care system, related to adults who are on the Choices for Independence waiver, which is the nursing home waiver, related to people with mental health disabilities who are not able to access services and are forced to go to New Hampshire Hospital or Glencliff. And then we just finished up a case around voting rights to make sure that people with disabilities could access their ability to access to vote privately and independently. We also provide a lot of individual legal assistance to people with disabilities and their families who call us for help. And so if someone needs our help, the best thing for them to do would be to reach out to us by phone or by email. We have or the contact us page on our website, and just let us know that you need help. When you speak to one of our support staff, they'll schedule, if you have a disability and you have a disability related legal issue that's within our broad priorities, they'll schedule you for an appointment to speak to an attorney. And then that attorney will have 30 minutes or so to really go into detail with you about that problem, to talk to you about what your options are, what the law says about the issue that you're facing, what your rights are, and to help you to make a decision about what you want to do moving forward. Sometimes, although our capacity is limited, we can actually help you to do that. Other times we're giving you technical advice and saying, these are your choices. It's up to you to make that decision. I'm giving you the tools so that you can make an informed decision, and now you can go try to advocate for yourself. You can follow up with us if that doesn't work. If you have more questions about what we do or kind of how that works, you should also look at our website, because that's a great resource. Kelly, how does the Institute on Disability use research and data as part of advocacy? And how does that help us too?
Yes.
And help the DB Council?
So as you heard the number of examples that Stephanie provided about consulting with an attorney, understanding what your rights are, understanding what the core of the issues are, that's where research and data that the Institute on Disability either creates or cultivates or can find as tools for advocacy. So when you think about using research and data for advocacy, it's a matter of what do some of the numbers tell us about where people are living, what types of settings they're working in, how much access they have to accommodations in the workplace? There are all sorts of data points that we collect in different areas of our lives and services. And one of the areas, the many areas of expertise that we have at the IOD are we collect a lot of that data, we manage a lot of that data, and we disseminate or share a lot of that data. So sometimes for, say, an attorney or an advocate, having information to say, this number of students with disabilities are included in this setting, or this many states looked at new ways to design their waiver programs. Places like the Institute on Disability can help our state to provide additional context for things happening in New Hampshire, or provide broader research and data about things that are happening across the United States. A couple other ways that we approach advocacy and education are also around providing training. One of the examples that we're going to talk a little bit about later on is how we work together to provide just-in-time or real-time training for people with disabilities, their families, and community members, because having training and good information is also a really important part of understanding what your rights are, being able to talk about them, and being able to share your story. Another way that we approach kind of through research and data, if you think about what we see in the media and on the news, there's all sorts of data and research that you see either about disability or the topics that we care about, and sometimes it's sort of hard to uncover of what does that data or research mean to me. And one of the many areas of expertise that we have is how do we provide technical assistance so people can understand that kind of data and research, and then how can we use it? How can we use data and research to educate policymakers, to talk to state agency staff, to talk to administrators in our school district or on our county boards? Another thing that's really important when we think about using data and research is we actually also conduct research. And so oftentimes the work that we do focuses on working in partnership with people with disabilities and community partners in designing research to better understand what works. Because oftentimes we know a lot about what the barriers are, but at the same time we want to understand what works better. So we have to design different types of studies or surveys or research that help us decide as a disability community, is that something we should be doing more of? Are we measuring and asking for the right things? And those are the kinds of things that we do at the Institute on Disability to further create tools and education around data and research. So, Isadora, I'm going to pose the same or a similar question to you about, can you talk a little bit about how the DD Council supports individuals and advocating for themselves?
Sure. A lot of our resources go into creating opportunities for people with disabilities and their families and the people who support them to share their own stories about their experiences and how they believe improvements can be made to better support the community inclusion of people with disabilities in New Hampshire. In our policy work, we follow bills that may have an impact on people with developmental disabilities, and we engage with legislators to be able to bring them lived experiences of people with disabilities, and people with disabilities can then share with our policymakers how they think a particular bill or law might impact their life, right? And then that helps legislators make decisions about what are some of the things that they should be supporting or advocating for. We also collaborate with other disability groups and organizations that use data collected, like the data that the IOD helps develop. We rely on that data because we act as a resource for policymakers also who are looking for information to better inform their decisions. We think it's important that people with disabilities have the same opportunities to exercise their civic engagement, to enjoy recreational activities, to be able to live in their community of choice, and to be able to work where they want. In some cases, because people with disabilities need some kind of supports or services to be able to do those things, we think it's really important that the council helps advocate for policies and initiatives that really are going to help reduce those barriers, right? And create opportunities so that people can really have a meaningful life in the community. So this is why we often advocate for things like accessible information, affordable and accessible housing, transportation, competitive integrated employment, and equitable education. All of these things are going to help create opportunities and remove barriers that exist for people with disabilities to engage in their communities.
Another area in which we collaborate is education and training. We do this independently in different ways, and we support each other's efforts in this area. Kelly, do you want to talk a little bit about how the IOD uses their expertise in education and training?
Yes, thank you for the question, Stephanie. And this is something that's clearly very important to us because as a university, it's also part of our mission as the University of New Hampshire, as a public land grant university, to be deeply connected and embedded within the community. So not only do we provide training and education within the university system, and so many of the different disciplines across the University of New Hampshire, particularly in the College of Health and Human Services, offer courses and topics related to disability. Some of those courses are taught by faculty and staff of the IOD and many of our faculty or staff partners across the college. One of the programs that some of our viewers might be familiar with is the New Hampshire Leadership Series. And that was one of the initial projects that the IOD first started with many years ago in the late 1980s. And there are more than 1,000 leadership grads across the state of New Hampshire. And at its core, the New Hampshire Leadership Series talks about, promotes, and educates individuals who experience disability and their families to be powerful, informed, engaged advocates and allies. And so whether that's being an advocate for your own story and experience, or an advocate and an ally for something bigger in sort of a grassroots community organizing way, New Hampshire Leadership Series helps trainees build that infrastructure, that knowledge, and that experience to make and be a part of both small and big social change. We also do a variety of individual trainings for, say, states or federal agencies or our other state partners. We also have training related to data and statistics. We have lots of training related to children's behavioral and mental health in the state of New Hampshire. We also provide a lot of training on public health initiatives related to health and safety in the workplace, health and well-being from a public health perspective. And so kind of depending on the types of products, grants or contracts that we have really also inform the types of training and education that we provide both to individuals and families, to UNH students, and then also to the community. So Stephanie, I'm going to pose the same question to you about how does the Disability Rights Center support education and training for people with disabilities to better understand their rights?
Thanks, Kelly. That's a great question. We have had some really great projects from our LIN trainees. So I just want to put a plug in for the LIN program because we've been really pleased with the LIN trainees we've had come work with us at DRC over the last couple of years. But one of the things that I did want to mention as we talk about how we reach out to people with disabilities about their rights is the Disability Rap Sheet. And that is a publication of the Disability Rights Center, the Institute on Disability, and the DD Council. We publish it about 2 times a year, and it focuses on a variety of different topics that we feel like we need to think differently about. So we had one about sexuality and disability. We had one about transition services and disability, housing and disability. We had with a special pull-out section about discrimination and how discrimination faces people with disabilities and how it more significantly impacts people with disabilities who are people of color. And so those have been really good. If you haven't ever checked one of those out, you should sign up. We can send you a copy. We can get you on the email list. But as I said, they come out about twice a year, and the next one is scheduled to come out, I think, around January. We're hard at work on it now. And that's a great opportunity where all 3 of our organizations really collaborate to reach out to people with disabilities. We occasionally do trainings for people with disabilities on their rights, but one of the things that we have actually really committed to over the last couple of years is making sure that when we work with partner organizations within the disability community and outside the disability community, within the legal community or within the advocacy community, is that all of these organizations really understand how important it is to make sure their events are accessible. Mm-hmm. This means that they have interpreters available. They have CART, which is the captioning available before anyone even asks for it, that they are making sure that the event's in an accessible location, and that there's a Zoom option to make sure people who have limited transportation can access it also. And so we feel like one of our resources is to help fund that occasionally, but to at least help support that so that other organizations can really think about accessibility as they think about reaching out to people with disabilities and to the general public. Isadora, you want to talk a little bit about the DD Council's work on education and training?
Sure. The DD Council supports and sponsors a number of different training and conference opportunities throughout the state annually. We actually just worked with the DRC on a voter rights training that was recorded as a webinar, and so that's going to be available for anyone who wasn't able to attend on our website and on our YouTube page. So that's one way that we are helping also branch out and reach out with our information. Other conferences that we support include the Employment Leadership Awards, the Caregivers Conference, the Transition Summit for youth that's transitioning from school into adult services and employment, just to name a few. We also recently supported a Direct Support Professional Appreciation Week event to help really bring information and education into the community about this important workforce, what it means to support people with disabilities in the community, and how people can get involved in that work. We work together with the DD Act Network partners on a number of groups and projects, and we also participate in different committees and groups throughout the state for a couple of different reasons. One is to make sure that there is a disability perspective considered in the work of those groups. So we call them adjacent groups, like how people working on housing, people working on transportation. We want to make sure that the needs of people with disabilities are being considered when there are conversations that impact the entire state of New Hampshire. And then the other reason that we typically attend these groups is because we can also offer technical assistance and support in making sure that information is accessible and can reach the disability community in an understandable and meaningful way. We also have the ability to give out small grants for community projects and educational activities, and this really enables us to reach statewide, right? So anyone can apply for a grant from the DD Council to make a trail more accessible, a playground more accessible, to have ASL interpreters at an event or an activity and make that more accessible. We tend to sponsor inclusive activities that are providing leadership opportunities for people with disabilities to help educate and train. That is really important to us, to support people with disabilities in leadership roles. And then we also have opportunities for bigger grants that go through the state's RFP or request for proposal process. And those big grants are, they're really intended to address things in innovative ways. So gaps that we see, for example, we funded a large grant for addressing the needs of individuals with intellectual and developmental disabilities who also have mental health conditions, and that the Center for Life Management, which is a community mental health provider, worked with the DD area agency in their region to really provide holistic services to individuals who have medical needs, mental health needs, developmental service needs, and it really helped develop a training that then allows other regions to replicate that model, the continuum of collaborative care model, and also provided trainings and resources on how to appropriately identify mental health conditions within the IDD population, and then what are some strategies to address those needs? We really appreciate the partnerships that we have, both with the DD Act federal partners and other organizations that really help us have that far reach with education and training about what's important for people with intellectual and developmental disabilities.
So I want to sort of end or kind of close our conversation with sort of a thoughts on thinking about creativity. So as DD Federal Act partners, we are all dedicated to thinking about creative ways to include people with disabilities in our work. And we recognize that there's still a lot that we have to do to make sure that everyone can be included in their communities in meaningful ways. And knowing this, we are continually working together, both independently and collaboratively, to improve on how we support advocacy, education, and training in New Hampshire. Isadora, how does the DD Council strive to reach people in the disability community that aren't currently connected to your work?
So we've made a real commitment to supporting information access for people with disabilities in a number of different ways. Part of that is language access, so it's important to have important materials and resources translated into other languages. And it's also important to connect with organizations and agencies that are working with people of diverse cultural and linguistic backgrounds who may need that information translated. And so that's one way that we help connect with folks that may not know about us yet. We also try to be really intentional about creating information and materials that is in plain language or easy read formats. And this really ensures that the information is accessible and gets its point across in really simple ways. Another way we do this, as I mentioned before, is we give out accessibility grants to organizations and groups that are looking to create either translated materials, easy to read materials, or to really have things like ASL or language interpretation services at their events and activities that really creates a welcoming environment for people of diverse cultural and linguistic backgrounds and people who experience disabilities and process information in different ways. So, and then finally, we try to reach people that don't know about us through video projects like these, which can live on our website and our YouTube page, and that we can push out through social media. Social media is really the best way to get the most up-to-date information about the DD Council and the projects that we're sponsoring and the initiatives we're supporting, in the hopes that we can build our reach and that our information can be shared with folks that don't know about us yet, that may want more information about what it means to advocate for people with disabilities, who are the organizations that are working on this important topic, and how they can get involved. Stephanie, how does the Disability Rights Center try to reach individuals that aren't currently connected to your work? And what are some topics that you're working on right now?
Thanks, Isadora. That's a great question. Yeah, I think just like the DD Council and I think the IOD too, we are really committed to making sure that we do our best to reach out to people who don't know about us. I always say that we are lucky in New Hampshire that most people with disabilities don't need our services that often. So I think we look at our outreach in a little bit different ways. I feel like we want to be able to touch people throughout their lifespan process so that they will know about us when they need us and they don't have to pay attention to us otherwise, because most of the time their life is going well and they're getting what they need and their life is good. So I really want to challenge people who know about us, the people who are even watching this video, to be that resource to people, to be the one to say, like, did you know about Disability Rights Center? Have you ever thought you might have legal rights that are being violated, that you might be helpful for you to talk to an attorney about your rights? Call them, they're free, they're happy to give you an appointment to speak to an attorney to get specific legal advice about your situation. And so I always challenge our staff, our board, our advisory council, our partners that we advocate for to really help us so that we can connect to people when they really need us, which is luckily not all the time. I think we do have a couple of special projects where we really are doing our best to reach out to people who we haven't connected with before. The first one is around voting rights. Isadora mentioned that we worked together on a video about voting rights, and I'm excited about that. We've also really taken the opportunity this year to deepen some of our partnerships with grassroots organizations that are doing voting rights training and education all the time to say, have you thought about disability and how that fits into the narratives that you're teaching people about? Do you know what to do if a person with a disability comes with a question? Could you send them over our way, or could we talk to you about that so that you're aware of disability-specific voting rights issues, and we can be a network for you, and we can also hear from you what you're hearing about so that we know what we should be prioritizing in terms of our work. The other project that I'm really excited about is one's funded by the DD Council, and that's around supported decision-making, which is an alternative to guardianship that protects the rights of the person with the disability to be supported in making their own decisions instead of being forced to be under a guardianship where their rights are really taken away. This is a whole new way of thinking about how to support people with disabilities to make their own decisions. It's a legal alternative now that was not available to people with disabilities before a couple of years ago. And so we're really spending a lot of time working with our partners and with advocates and with people with disabilities themselves to think about what that looks like in New Hampshire and how we can make sure people with disabilities really do have the choice to live the lives that they want to live, and that they're empowered to do that with support from others instead of with someone else taking over the right to make those decisions. Kelly, do you want to talk a little bit about how the IOD reaches out to people with disabilities?
Yes. First and foremost, for us, our network really is the university community, the different departments, the different colleges, the different USEDs across the country, and our association. So that is one way that we sort of reach and connect a wide variety of people and audiences. Another really important way that we do this too is through our Consumer Advisory Council, or our CAC. And so our CAC is one of the supportive advisory groups that the IOD has that includes people with disabilities and their families and allies as part of a group of people that get together and talk about issues related to the important topics and the timely topics, as well as coming up with ideas and strategies to say, well, this is how we might approach this as a university community. Maybe this is a strategy that we could work with others on. That said, as we really do recognize that there are people we're not reaching. There are many people that don't show up in data or research or at events because the information is either not available, accessible, or we just don't know about them. A couple other things that we're sort of thinking about goes a little bit to what Stephanie was sharing around DEI initiatives, or diversity, equity, and inclusion. And the fact that many times when we talk about diversity, equity, and inclusion, we're not always thinking about disability. And so it's taking those DEI conversations and really framing them in a way of which disability diversity is part of diversity, and that disability should be part of the conversation when we're engaging in DEI planning, strategies, and priorities. The other thing that I'm really excited about is how are we increasing capacity at the IOD about making higher education, or the benefits of education through the university, accessible to more people. We're also developing a lot of trainings for paraprofessionals, paraeducators, different types of staff and workforce. So how does the university itself act as a vehicle for good to make training and continuing ed accessible to more people? And you've heard throughout our conversation today the importance of sort of sharing our stories and sharing our experiences. And one of the things I think when you talk to many policymakers, I wouldn't say all of them, but it's this the strength that comes from being able to share data and research and individual stories together as some of the most powerful tools for advocacy and education. And so how do we further sort of leverage both of those to create both the stories, the experiences, and the narratives that not only reflect the data and sort of show us what we need, but also reflect back to us what are the experiences of people with disabilities and their families. I think our work at the IOD really couldn't be done without the strong partnership and connectivity with the DRC and the DD Council.
I want to thank you for joining us today to talk about advocacy and education and to learn a little bit more about the DD Act federal partnership here in New Hampshire. We hope that this was enjoyable and informative, and if you're interested in getting more information, we will have our contact information available at the end of the segment. We really encourage you to think about how advocacy and education and training really motivates you to share your story, share your experience, and get involved in disability advocacy in New Hampshire, however you think that fits for you. Thank you, and thank you.